Dr. Terrell Joseph with Vail-Summit Orthopedics and Neurosurgery, and specialize in upper extremity and knee surgery. And today we're going to be talking about wrist injuries. So I'm going to reach in and pull out the question down in this boot. Can skiing make carpal tunnel worse? Skiing doesn't really make carpal tunnel worse. Carpal tunnel syndrome is a nerve compression. It's right here in this area of the wrist. Biking does make it worse with gripping and grasping like that. And most patients complain of numbness and tingling at night. Gripping a ski pole like that maybe could aggravate it, but that's not typical. How can you tell the difference between a wrist sprain and a broken wrist? So a couple of clues. Sprains don't typically make the wrist or any joint black and blue. That's always suspicious of a fracture, and that can be applied to anywhere, including the wrist. If you press on your bone and it hurts a lot, well, duh, that's probably suspicion for a fracture. If you push on a joint, the joint is where the ligaments live. So you got a joint where the ligaments live, and then you have the bone, and that's the difference in our world. And again, that can be applied to everywhere in the body. So if you're hurting on your bone and you're black and blue, that's an x-ray. What are the most common wrist injuries you see during winter? By far, the most common wrist injury we see is what's called a distal radius fracture. So this is the radius bone right here. It twists like that, the radius of curvature. And when patients fall and land like that, the by far most common fracture is a distal radius fracture. And so even if it's a bad fracture and it needs surgery, which we do all winter long, almost weekly, they do excellent. They tend to all heal, and the function is restored, and so it's a pretty good bone to break if you have to break a bone. How long is too long for a wrist to hurt? If a wrist is hurting for more than about 2 weeks, then you probably should have it looked at. Most ligament sprains in the body and in the wrist included will get significantly better or go away within about 2 weeks. If 2 weeks has gone by and the pain is the same, especially if you load up a joint or load up a bone and it creates increased pain, then we worry that there could be a fracture. Thanks for joining us at Vail Valley Live, Ask a Doctor.